Cervical disc replacement, or cervical disc arthroplasty, is a surgery that is performed through the anterior approach to the neck. It's an incision in the skin creases of the neck, dissection through the middle cervical fascia that goes between the medial musculovisceral column and the carotid sheath. It allows access to the front of the spine where the disc can be accessed safely, removed. The neural elements can be decompressed from an anterior approach, and a mobile bearing can be inserted in place of the disc to allow motion at the disc base. The advantage to that over, say, an anterior cervical discectomy infusion is that the mobile bearing allows motion at that level, which should minimize the risk of adjacent segment degeneration because the segment is no longer stiff and transferring stress to the next disc. The indications for cervical disc arthroplasty are very similar to anterior cervical discectomy infusion. They include cervical radiculopathy, cervical disc herniations, and foraminal stenosis. The relative contraindication is any sort of spinal cord compression or myelopathy, or anybody with advanced degenerative changes that involve the facet joints, which can be a source of pain if you maintain motion anteriorly. The advantages of cervical disc arthroplasty over anterior cervical discectomy infusion is that you maintain motion at that motion segment, which should decrease the risk of adjacent segment degeneration. The fact that you don't have to get the bone to grow all the way across the disc space and into the implant also allows you to return to activities quicker. If you have long-standing degenerative changes in your neck and facet arthritis, the facets are the joints in the back of the spine that move with the disc, the cervical disc replacement may not be a procedure for you because allowing the disc to be replaced with a mobile bearing but still loading the arthritic facets could still lead to significant neck pain. In the setting of spinal cord compression, cervical disc arthroplasty is relatively contraindicated because that tends to do better with removing the motion and also tends to be in patients with much more advanced degenerative disease, which is more amenable to infusion. Other advantages of the cervical disc arthroplasty is, since you're not asking the two bones to grow together, the return to regular activities is quicker. Typically, the implants are porous coated and you only need bone to ingrow a very small distance, so most people can return to full activities at 6 weeks post-operatively. The risks of cervical disc replacement are the same as for anterior cervical discectomy infusion. They include things like death, paralysis, infection, bleeding, pain, need for future surgery, risks of anesthesia, risks of spinal fluid. There's a very small risk that the bone might not heal. Typically, that's in patients who smoke or have low vitamin D levels, which is why we supplement all our patients with calcium and vitamin D both preoperatively and postoperatively. Most people have a little bit of hoarseness or a little bit of difficulty swallowing immediately after surgery because they have a sensation that there's a swollen lump in the back of their throat because there's a swollen lump in the back of their throat. But that typically goes down and will resolve with time. But the fundamental risk is that that can persist. The expected recovery time for cervical disc arthroplasty is relatively short. For patients who have desk-type work or don't do any heavy bending, lifting, or twisting, they can typically return to work in 2 weeks. For the bone ingrowth to occur, it typically takes 6 weeks, so that allows people to return to regular activities in a shorter time frame than if they had a cervical fusion.